Hi, I'm Dr. Corey Maas, a board-certified facial plastic surgeon in San Francisco and an associate clinical professor at the University of California, San Francisco. I have a particular interest in our Maas Clinic, which is focused on aesthetic surgery of the breast, body, and face, and my area is the face, in rhinoplasty. Rhinoplasty makes up about 40% of my patients, and in fact, about half of those patients are revision rhinoplasties or correcting some small irregularities that have occurred in previous surgeries for patients. I wanted to talk to you just a little bit about how rhinoplasty is done and how we can get really nice results for people. The first and most important thing about rhinoplasty is that noses are very personal things. I don't begin to believe that I can tell people how their noses should look. Some people want to retain their ethnic features. Some people want to have a little bit of a bump on their nose. Some people want to have greater width. So within a series of parameters that we know are the ideal aesthetic, we work with the patient for their individual concerns and needs and are able to achieve with a high degree of success an outcome that gives them balanced facial features that they're very pleased with, retaining their ethnicity, retaining the features that they'd like to keep about their nose. So in general with rhinoplasty, there are a couple of approaches described as endonasal and external or open rhinoplasty approaches. It's very individual for patients as to which approach is taken. In general, most of the incisions for both of these procedures are done through the inside of the nose. There's nothing to be seen at all on the outside. The only incision made with an external approach is a tiny little W incision across the columella here, and this gives us access to the paired lower lateral cartilages that supply support to the tip of the nose. Those are shaped as you see here. The nasal septum, which divides the nose into the two compartments, and the nasal bones that lie up above, and they're fused. When we're adjusting the nose, we're simply getting that exposure, adjusting the septum and the tip cartilages that I described, and again, through the inside of the nose, making little incisions through the bone if necessary to reduce the height or width of the nose in general. These procedures are done as an outpatient. There's something that you can do with a minimum of anesthesia so that people feel pretty well when they wake up. There's typically very little discomfort after the procedure. Patients are a little stuffy afterward. And in general, people are back and doing their normal social functioning things within a couple weeks after the surgery. Let's take a look at a couple before and after pictures that I think show you that a good nose surgery can make you look better, balance your features, but still become very natural and be totally unnoticeable by your friends and family. So if you're interested in more information about this, I encourage you to go to the website. We've got a lot of information about how it's done. There are pictures, more pictures of before and afters, or certainly call the office for a consultation where I can sit down with you and on the computer show you what your nose looks like now and what it could look like if you had a rhinoplasty procedure at the Maas Clinic. Thanks.